Okay, Goran, you got something to tell me about the dangers of something with the Doctor Chronicles this week. And what is dangerous, Goran?
There are many things which are dangerous in life.
Uh-huh.
There
Alcohol.
are many, yes, alcohol being one of them. Paracetamol.
Paracetamol.
Right. I had another
Blood
one.
clots.
Blood clots. See, you're learning.
Blood pressure.
Blood pressure. You're learning so
Food
much.
poisoning.
Food poisoning. I mean, look, you're just quoting everything. I mean, I had a guy. We'll come to obviously what this is about today, but I was doing a health screening clinic. So this is something I do not in a hospital.
Mm-hmm.
So basically, a guy applying for a taxi license. Okay, and blood pressure super high, man. So I'm talking. Remember we talked about normal numbers?
Mm-hmm.
Okay, top number is like 190.
Oh.
Yeah. Bottom number is like more than 100, and but he's asymptomatic, right? He has no symptoms. This is the thing, and I think I stressed it on that segment that blood pressure is a silent killer, and in developed countries, us, America, US, all these other places, it's chronic
We struggle
disease.
with
Chronic
keeping
disease.
blood pressure numbers under
Blood
control.
pressure, diabetes, obesity. These are the things that
Only
kill
in
us.
developed countries. Well,
Yeah.
not only, but it's more prominent.
It's more prominent because obviously in these other countries, infectious disease is still quite high. People are still dying of pneumonias. Man, I had a GP come to me yesterday and was like, "Oh, this guy's come from Spain, and he's got like worms coming out his bum, like parasitic worms."
What the fuck?
Yeah, I didn't think to put that on the podcast. But I was just like, "No, you got to remember."
Oh my! Hang on, hold.
You're trying to process that, aren't you?
Oh,
Like it's in the poo. It's in the poo. Parasitic worms.
Oh my god!
Hi, kloppy dog roll de men. Hi.
What? Like, how do you treat that?
Yeah, so you use it's essentially you're going to use antiparasitic antibiotics.
Is it a tapeworm or something?
I don't know what it was. The GP came to me. She said, "What do you think?" I said, "Right, the patient obviously needs to come in. We need to speak to infectious disease." That was it. It's like, although, and remember, I'm essentially a general
Practitioner.
No, that's a GP. I'm a generalist of acute medicine, so I know a lot about a lot of things. But there are some things just in the UK we don't see that often.
Did you ever watch House?
Yes.
So there was an episode of House where like he's going speed dating with a woman,
Okay.
and she says, "So you're a doctor?" He said, "Yeah." "So what do you do?" He said, "I'm a diagnostician."
Yep.
And she said, "What does that mean?" He said, "I diagnose patients."
Yeah.
And she said, "Isn't that what all doctors do?"
Yeah.
And he said, "Yeah, but they can't dance like I can." Like he was taking the piss because he's like, "Fuck you," basically, right?
Yeah.
And it's true. I was like, "Yeah, I understand that."
No, he has a good point actually. That is a really good point there. It's the bit about medicine that I actually enjoy is that it's the Sherlock Holmes. It's what is the diagnosis, because the other side of it is you got to perform or carry out the treatment.
Yeah.
Some people like that, they like executing. For example, heart attack, blocked artery, put the stent in. Okay, so let me tell you how that plays out. Somebody presents at the front door meaning the first part of A&E, right? So via their ambulance or they walk in. I had a lady yesterday. She had a heart rate of 30. Okay, super low heart rate, feeling dizzy, nearly passing out. Did the ECG tracing of the heart. I was like, "Oh, you have complete heart block," right? Treatment for that, pacemaker.
Yeah.
Dub bar in your chest.
Yeah.
Rewire. Essentially what happens is in your heart you have 4 chambers.
Mm-hmm.
Okay, so 4 chambers, 2 at the top, 2 at the bottom.
Yeah.
2 ones at the top are what we call your atria.
Yeah.
And the 2 at the bottom we call your ventricles. Okay. Basic function of the heart is the top 2 fill up with blood, then they push that blood into the ventricles, then the ventricles push out blood to the rest of your body.
Mm-hmm.
Okay. They have to work in synchrony. So the top contract, bottom relax, and then they contract while they relax. Has to be like this.
Yeah.
Okay. If that becomes dysynchronous, if the wiring goes off, that's a problem.
Because it's pushing out blood that ain't there.
Well, exactly. Or it's like that's
blood's going in
that's
and it's
contracting,
not
it's just-
pushing out.
right? And so the reason why this lady is becoming dizzy is because at some points there's not enough blood coming out the heart. Less blood comes out the heart, less blood pressure or lower blood pressure, not enough blood to the brain, dizzy, pass out. See, that's like really advanced medicine, which I've taught you in like 20 seconds.
Boom. And
Right.
that's going on TikTok. Anyway,
TikTok, baby.
Continue.
So, and this isn't what I prepared for today for
it's
the
not.
Dr. Chronicle, but she had complete heart block, wiring gone, low heart rate, need a permanent pacemaker. I've made the diagnosis. That's the fun bit. I'm not the person who does a pacemaker. That's a cardiologist. Needs to go over. So I pick up the phone. "Hey, Beck," one of my cardiology nurses, or one of the cardiology nurses, sorry. Got this lady. She's got the symptoms. I've done the ECG. Come and look at it. I think it's complete heart block. We need to do this, this, and this. That's it, sorted.
Karen, when that moment happens and
I feel so
realize
validated.
it, how happy do you feel?
And you know what? I've been a doctor for a while now, like coming up to my 10th year, and I still get the buzz, man.
Yeah, yeah.
Because it's like the more I do this, the more I realize, like, you know, medicine is an art, man. And I was showing my juniors, like, they'll look at the same ECG and they can't see it. And it's like, it's not that I'm clever. It's just I've looked at a lot of these now, and I can hear. And you know, in med school we get taught this thing, Indy, which is like when you speak to a patient, 90% of the diagnosis is in the history, what the patient tells you.
Yeah.
Well, what the patient tells you and the quality of the questions. If I ask you high yield questions, by that I mean if you're a new doctor, you might have to ask 50 questions to get the response you want.
Yeah, but also consider Gregory House. Everybody lies.
Everybody lies. Yes, that's
There you
also
go.
very important.
Never
So you've got to
forget
ask
that.
the right question to get the right answer.
Yes.
Experience teaches you the best question to ask. So rather than 50 questions, maybe ask you 10 questions, I get to the same thing quicker, right? All the rest, the other 10% of the diagnosis is the blood tests, is the x-rays, the da-da-da-da.
Yeah.
90% is that first bit. And I realize this now, but my acuity now for certain things, my interest is cardiology, everything to do with the heart, is more astute, I would say. Now that I'm working super frontline, meaning I'm the first or second touch point, I get to see these things. So yeah, absolutely got the buzz. And so yes, so my role there is diagnosis, not treatment. But love it.
See?
Anyway, it is cardiac related, the thing we're going to talk about today. So
Go
the
on.
dangers of pre-workout. Big craze at the moment, right? So, I mean, even in lockdown, you know, I had a friend who was like, Jazz, try this pre-workout, right? He goes, you will feel like Spider-Man. You want to crawl up the wall. This is literally what he said. He goes, you go tingly.
Spider-Man.
He goes, you go tingly and like you have the spider sense.
You go tingly.
He goes, you'll want to climb up the walls, man. Like he goes, you will like be like wired, right? And so I tried this shit, this blue shit. I don't know what it was, man.
Was it NO explode?
I don't know, man. Like he just he made it up for me. Like he put it in my bottle or whatever, and then I made it with Barney water and drank it. And oh my God, right? Like that day, this is a while ago, like I benched 52.5, which was like, you know, PB for me then. And I was like, oh my God, I'm just banging up these reps, man. I was like, I don't want this workout to end, man. And the problem I found was, fine, I done my workout. I got what I need to do, but the shit is still in my system, man. And I'm like,
You weren't sleeping for shit that night, mate.
right? So I'm like, when is this going to leave? So medically, this what we call this is bioavailability and half-life. So when somebody comes in with an overdose, it's the same thing. We're trying to work out
What's the half-life between that and the end, and then figure out how much treatment they need to get them to the half-life quicker? Is that right? Or to get the body to process it quicker?
Well, it's more like if you've taken something, do I need to do anything? Is it already out your system, right? Or how long do I need to monitor you for? That's what I'm trying to work out. When's the peak concentration?
Right, got it, yeah.
So I'm there like, oh my God, I'm so wired. Like, oh my God. Like, I'm just going to keep doing productivity. Da, da, da. So that was my issue with pre-workout. So this young kid
If
comes
you take
in.
it first thing in the morning, though,
Yeah, I never. I mean, yeah, I don't
your
work out
day
now.
is off to a right kicker, man.
Right. Okay.
Straight up, your day is like bam, 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 bam. And
Spider-Man.
then come about 2 p.m., you're like,
Spider-Man.
you start flagging hard.
Yeah,
Because your heart's been like banging itself to death for like 8
you
hours,
can't
man.
maintain it, man. You can't maintain it. And the only thing I'd compare it to, probably lesser degree, I think this would be my levels. There's that pre-workout I had. Then there's Red Bull, right? So Red Bull for me is, we're going on a stag or a boys trip. The lads are all drinking. We're going out at night. I need to stay awake. Obviously, don't drink Red Bull. One can of Red Bull takes me from 11
That's it.
p.m. to 6 a.m.
That's
I
it, done.
am wired, man. I can do bung it out all night. I can talk to girls. I can do whatever, man.
Talk to girls. Oh, okay.
Yeah.
Is this allowed? I don't know.
Yeah, look, you're not doing anything, but it's like, you gotta have a bit of fun, man. Talking to dudes is boring, man.
Yeah, it's true.
So it's like, just chat to whoever's there on it. And yeah, so pre-workout, Red Bull. And then I'd
Coffee.
say everything else. Yeah, so my current kind of, I'm going to hit the gym is a double espresso. For me, I have enough kick 30 minutes before, gets in my system, I have a great workout.
I just have a
and
coffee.
out.
That's it. All I
If
have
I'm
is
black-
just like, I just have my normal coffee every day. I just have it at the beginning of the workout.
Fine.
And then I do it. Because if I have Red Bull or anything, it's too much caffeine
Yeah,
for
and it
my
goes-
body to process. And also, I need a shit in the gym, and I don't want to go for a shit in the gym.
This
Coffee,
is,
I can hold it back a little bit. I'm like, you know what, I can handle this. Yeah. But man, if you take a Red Bull or a pre-workout before you go gym, and it's the second or third time your body's having it, it doesn't give you the same caffeine response anymore. It gives you like a close to it, but it gets less and less and less and less each
we
time.
call that habituation.
But
yeah.
your body's like, oh, I need to go for a shit more and more and more and more. So it doesn't balance out. It's like, it's not worth it. It's not worth it.
No, I went through that phase as well where I was having to do a poo before working out Because there are, there are some exercises where, and especially when we do power day
Yeah.
and you're lifting heavy and you're really straining, you're like, my God, pad nikal jana. And if
Straight
the
up.
pad comes out, you think I'm going to follow through.
Yeah.
Am I going to shot? Like this big risk, man, big risk. So this young dude comes into Indy, right? And he's like, oh man, like, I can't breathe. And I've got chest pain and my heart's racing. I was speaking to this dude. And so if anybody
Was he in
comes
gym attire? Was he in gym attire?
I mean, it's casual. It wasn't particularly. I didn't like gym gloves or anything, but like, no, I didn't have like Gymshark on or anything like that.
So did it make it obvious that he'd taken the pre-workout?
No. And the thing was, it wasn't today he'd taken it. So
Oh, shit.
it was
Okay.
it was a few days ago, and he was okay when he actually saw me. He was just, I've been having these symptoms. I thought I should get checked out rather than it's happening right now. And then I was speaking to him, and if anybody comes in and they have palpitations, racing of the heart, then the things that come to mind are, so guys, things to think about: energy drinks, coffee, tea. I'm talking like if you're drinking more than 6-7 cups, that's enough, man. That will stimulate your heart. Have you got a thyroid issue, right? So having an overactive thyroid, very common condition, will make your heart race. Are you taking funny drugs? Obviously a question we need to ask. Is your heart rate going so fast that you're feeling dizzy and you're passing out? Big red flag. Is it happening when you're not doing anything or when you're doing something? So doing something means exertion. So for example, if you said to me, oh, my heart races a little bit and I'm not doing anything, I'm just typing on my laptop, I'm less concerned. But if you said to me, I'm at the gym and it comes on while I'm gymming, more concerned. That's what we call exertionally driven. Your heart is being stressed. It's coming on. I need to think about what's the etiology. Etiology means what's driving this? What's the cause of that? Okay. So then I speak to the dude and he's like, yeah. I'm just, I've been stagnant in the gym for a while. So I just want to kick it up a gear. So I start taking pre-workout. And he goes, but thinking he self-diagnosed. He was like, yeah, I realized these symptoms only happen when I take pre-workout. And I was like, bro, what's happening is your body is using that pre-workout, right? And you're getting a hyper-stimulated response. And it's just too much. It's too much, right? So you're getting palpitations. Your heart rate is going so fast. Think of it like, you've done a 100-meter sprint, but you're not doing anything. You're just sprinting, but your body...
Yeah.
Like, there was a test that we do. It's a bit of a side story here, but again, more about the heart. So if you come in Indy and you say, oh, I'm having chest pains all the time, right? One of the main concerns about chest pain is this the start of angina, blockages in your heart, which could precipitate a heart attack?
Yeah.
So then, well, how do we diagnose that? Well, we could do an ECG. The ECG might be completely normal. Okay, we could do a blood test looking for damage to the heart attack. That could be normal because you're not having a heart attack, but you could still have blockages. So how do I then look for the blockages in your heart? Okay.
Yeah.
3 ways of doing this. So one, I could stick you on a treadmill, put some ECG stickers
Like
on.
how they do in films.
Yeah, it's real. It's called
Yeah.
an ETT, exercise tolerance test. Basically, we stress you, and in the hope of stressing you, we're looking at ECG to see, are we now inducing angina?
Can I
I'm trying
just
to bring
pause
it
you for one sec?
Go.
Every time I think of that test, I think back to the episode of The Simpsons where they got Mully? They got Mulder and Scully in, and then they put Homer on the treadmill,
Right.
and they made him run with
Right.
like the thing on.
Yeah.
And Mulder asked Scully, "Why are we doing this?"
Yeah.
And he's like, "Oh, I just thought he should lose some weight." Right? And I was like, every time I think of that test,
That's what
I
you
think
got.
of that scene from The Simpsons. I don't think of like a film. That's the first instance I had of it. I was like, oh, why do they do that? But in films, you're like seeing someone run like going for it, like fully fit, ripped, jacked to shreds.
Yeah.
And you look at Homer Simpson, right?
Yeah,
Big
yeah,
difference.
yeah, yeah.
Big difference.
But those are the type of people, man. But there are people who are, their body habitus is so large that they're unsuitable for that test. So that's the first way of stressing the heart. Second way we stress the heart is we put a cannula in. We give you something called dobutamine. It's a drug, which makes your heart go. So what we're doing is so we're trying to mimic you being on the treadmill. Make the heart
Without
go
making
fast.
you get on the treadmill.
Yep. And then see, does something happen? As in, do you start developing chest pain, number one? And on the ECG, are we seeing areas of ischemia? So ischemia means there's a lack of blood supply going to that area, which again could precipitate heart attack. Third way, the most invasive way, is what we call an angiogram. Angiogram is where you take a wire in either the wrist or the groin while awake, so you have a bit of local anesthetic. Okay. When I say wire, as in what goes in, it just looks like a cannula. You don't see the wire. We feed the wire in. Okay. That goes into your heart You are. I mean,
Oh, so hang on, hold on.
Hold
this wire,
on.
this wire's going through my fucking arm into my heart.
Yeah, or your groin.
No,
Daddy, no.
I'm gonna hold on to something, man. I'm not doing that.
Yeah.
Are you mad?
Yeah.
Do you tell the person you're doing that?
Yeah. So with any procedure, whether it's a lumbar puncture or whatever it might be,
I'd rather run on the treadmill, mate.
No. This is the gold standard test. 'Cause remember, like well, you should know, if somebody has a heart attack and we need to put a stent in, how do you think we get the stent there?
I thought you cut them open.
No, that's a bypass.
So how do you get a stent in there?
We pass it through there. We inflate it when it's inside. That's it. The person is awake. They watch their heart on the screen, if they want to. So you pass the wire inside. You get into the arteries.
If I ever needed motivation to get up and go to the gym in the morning, it's this. This conversation right here will make me go to the gym every fucking morning to not have this invasive procedure
Angiogram.
put in my arm or in my groin.
In your groin.
Jesus Christ. Okay, sorry, continue.
Yeah. So what we're doing here is direct visualization. We're looking inside the vessel to see, is there a blockage, yes or no? So if somebody has a heart attack, they come in. We've diagnosed a heart attack based on the ECG, the blood test. Once we pass that wire in, the angiogram, if there is a blockage that is amenable to treatment, we can then pass a stent or a balloon to...
Pops up, yeah.
Yes.
It inflates.
And therefore the blood flow improves. That's basically what we call PCI. That's the treatment for a heart attack. PCI stands for primary coronary intervention.
Going back to this guy.
Going back to this, I said, look,
happens?
the problem here is, right, so this is a good segue into that. 95% of heart attacks are due to a blockage.
Yeah.
Right? But the other way to get a heart attack is if you mess with the supply and demand. So by that I mean, if I made your heart rate 300 beats a minute.
Is that possible?
It's not possible.
Okay, yeah.
Like 200, I can make it 200, 240, right?
What's the max, FYI?
Generally, your max heart rate is 220 minus your age.
Okay.
It changes
Continue.
as you get older, right? But if I make your heart rate really quick, eventually what will happen is there's not enough blood going to your own heart. The heart gives blood to itself. That's why you get a heart attack. It's the blood supply to itself that's the problem, right? So in that issue, there's no blockage. If I looked inside your vessels, there's no blockage, but you're going so fast that you can't get blood, supply and demand. And I said to this dude, look, you're fine now, but there are people who have so much pre-workout that you can actually get a heart attack. There was a case I read, I think an 18-year-old or 19-year-old having so much pre-workout, he put his heart into that kind of supply and demand issue. So we call that a type 2 heart attack. A type 1 heart attack is the one we all know. It's the blockage problem. It's a big clot that breaks off. Blood can't get through, right? This is a supply and demand. The other way to induce is if I chop your arm off and you start bleeding out.
Yeah, your hemoglobin goes from...
Down. Obviously, at some point you'll die. But in that period before you die, when it's low, again, there's now a supply and demand issue.
Mm-hmm.
There's no blockage in your arteries, but there's not enough blood going to your heart. Give you a heart attack. So the risks and perils of having too much pre-workout are, one, because you're going so fast, your heart is going really, really fast, right? Obviously, it's trying to give you more blood and oxygen so you can work out. That's the kind of the premise of it. It makes you really wired. If that's sustained too long, so like this guy, he obviously had a reaction to it. Not everybody's going to have the same thing. Then you can then develop chest pain and shortness of breath, right? Or you can go into a dangerous heart rhythm. So into something, what we call a SVT, supraventricular tachycardia. So something which is unregulated. So normally your heart is just, regular, right? And even if you run around, it goes fast, but it's regular. But if you go into this dangerous rhythm, then obviously other things can happen, and that can be the prerequisite to your heart stopping. So, and like I said, there has been that young case I read of a young person having a heart attack because of pre-workout. So just don't do it, man.
Don't take pre-workout. That's the summary.
You can take it, but just...
If you have a bad reaction,
yeah,
don't
exactly.
do it
again. So each person is different. Be sensitive to your own body's needs. If it's, if the effects of the pre-workout are lasting hours and hours after you've done your workout, that's not a good thing. I even said to this guy, I was like, I remember a top level athlete asking him, a cyclist, this guy, right? And I was like, what do you do before you have a workout? He goes, 2 slices of bread, jam in the middle, kela, banana, that's it.
Go.
Yeah, he goes, my banana is my slow acting release carb, and my jam and the bread is, well, the jam also is my quick acting effective. For me personally, it's that double espresso. For you, coffee. But yeah.
Jesus, man. If I've ever needed a reason to not take pre-workout, it's been given to me right there.
You want,
And
hang on. A summary or are you good?
But I think he gave one.
Good.
But did this guy not? Did he tell you how much he took?
No, it wasn't really relevant. Like
He just took a normal amount.
yeah. I was like, dude, just relax. Nothing's gonna happen. Don't take it. Keep going to the gym. You'll make gains.
Slowly.
Get a PT. Yeah, exactly. Slowly. I mean, it's just educating people about
Don't
that.
tell me you gave your PT as like a card for him.
No. He wasn't
Okay,
from around
jeez,
here. But I
thank
said, just if you want gains, get PT, man. Like you want to learn something, find someone who can teach you, and just get there quicker. You will get there eventually, maybe. But gym's an interesting thing. Though there are people in the gym who've been there 5-10 years, no progress, very little progress. It's like fine if you're doing it because, well, I don't know why you're doing it, but if you want results, accelerated results in anything in life, get someone to share to do it.
Get a good PT, not any PT, a good PT.
Yeah.
And don't judge them by the before or after pictures. It's all bollocks, right? Anyway.
Like theirs or clients, you mean?
So when they give a client's one
Oh,
of
like
their
someone.
own,
Yeah.
don't use that as like a indicator
Benchmark.
point of being good.
Yeah,
It
yeah.
doesn't work. I could take the top 1% of anything and just put that out and say, here you go. This is the best. It's the best I've done with someone. I'm like, great. What about the other 99%? What does that look like? Yeah, marketing.